co-founder of Healthify. First, I want to thank the Acumen team for their support and inviting me here today. I'm really excited to be here and really humbled and honored to speak with such an incredible and passionate audience. So at Healthify, what we were really focused on, we're a New York digital health startup, really hyper-focused on how do we address the social needs of patients. And one of the first slides I have here is there's more to health than healthcare. And it's been a running theme throughout my talk where reality is that healthcare and clinical care really overlooks one of the biggest components to health, which are really social determinants. And before I get into what I mean by that, what we do at Healthify, what our progress is, I want to talk a little bit about the context of the poor state of affairs in the US healthcare system right now. So to start off, we spend a lot. And I think people know this. I think I'm preaching to the choir here. But to give you a sense of the scale of the problem, compared to other developed nations, we're spending 2.5x more. And you would think that we're spending so much on healthcare, we should be seeing a good return from it. We should be seeing great health outcomes. And I think the reality is we're not. I mean, looking at one modality, life expectancy, we're pretty low on the list. And this is obviously an average. When you look at certain communities, I think the wisdom and the statement, your zip code matters more than your genetic code, is incredibly true. I got my start doing work in East Baltimore, and certain communities, your life expectancy is sub 70 years of age. And that's the fundamental issue, is that we're spending quite a bit, and we're not seeing tremendous value. And the reality is because we're not really addressing the elephant in the room in healthcare, which are really the social determinants of health. Someone's food situation, housing, access to childcare, access to mental health, access to behavioral health services, access to transportation. All of these needs pop up day in and day out, and they're not systematically addressed as a part of the healthcare system or clinical care. And going back to my experiences in Baltimore, myself and my team, and if people don't know the East Baltimore community, it's a community with a tremendous amount of need. A high Medicaid population, so low income, and for reference, there are about 70 million people on Medicaid right now in the US. We were at a pediatric clinic, a community psychiatry clinic, and doing door-to-door visits from a men and family center, and when you're on the ground, it's pretty blatantly obvious. Someone might be coming in for an appointment, but the main thing they're concerned about when they go back home is, I have trouble paying for food in the next 30 days. I can't pay for my meds. I'm at risk for homelessness. I need a better job. I need a stronger education. Those are the things that are keeping them up at night. Those are the things that are impacting their family and their kids. And the healthcare system really has nothing to say about it. And it's not just me experiencing this on the ground and other social workers and community health workers and nonprofits doing incredible work, seeing this day by day. From multiple lines of inquiry now, we know that social needs are driving about 60% of our health outcomes. So if you look at clinical care, 20%. All of that 2.5x in spending compared to other developed nations, primarily going to clinical care, when we know for certain that 60% of our outcomes are linked to social needs. So there's a fundamental disconnect there. And when I talk about social determinants, I think it's important to talk about all the various ways these needs can manifest themselves. People obviously gravitate toward the most acute needs: food, housing, childcare. But let's say you look at the Medicare population, elderly population in the US, who don't have a caregiver or don't have social supports at home. Anxiety and depression is significantly high. Your financial stability in your environment, basically where you live, work, and play, is going to drive a lot of your outcomes, a lot of stress, and a lot of these outcome predictors mentioned below. And this is actually coming from the Kaiser Family Foundation. So it spans a lot. These needs bleed into each other and are circular at times. So what are people doing? So a lot of people in the healthcare space, so we have large hospital systems, large insurers, and I do think this need bleeds in a global context as well, not only in the US healthcare system, but in the US, from our perspective, some of the pain points we identified, which is really what got us riled up and really wanted to make us start Healthify, was number one, on the left here, it's really tough to figure out who in a population is in need and the severity of their need. So the example I always like to share is food insecurity. Screening for food insecurity, meaning family cannot afford food in the next 30 days, happens about 7 to 10% of the time. And that's coming from one of the most prestigious hospital systems in the world, Johns Hopkins. Even though we know if a family is food insecure, they're 40% more likely to be hospitalized. So there's this gap where we know for certain that if we identify this need, it's going to lead to not only a bad outcome, but going back to the cost argument, a pretty tremendous cost and burden on the healthcare system. And we're not screening people for these needs. So there's this barometer issue where we don't know who's in need, and the severity of their need. Pain point 2 is it's very tough to figure out what services can help. There are thousands of community-based services, benefit programs, social services doing incredible work in the community, but a lot of folks don't know how to access them. What are the eligibility requirements? What are the intake requirements? Do they have any capacity? How good is their service? Are there any ratings on it? There's a huge data problem where people can't find out what they need to find. So if a single mother comes in needing childcare and another housing option, that will take you hours and hours to find an appropriate service. And even if you're lucky enough to find it, even if you're lucky enough to identify the need, more likely than not, that information you're relying on is old, outdated, not validated, and tough to share. And that's kind of the second pain point, a data problem. And the final pain point, it's really tough to follow up. So let's say you identify the need, you figure out what services might be helpful, and you share that with someone. That's really where it stops. You never know if someone went to the service. You never know if it was helpful, what the impact on the health outcome was, what the impact on the cost was, and that's really the holy grail. If we really want to fundamentally solve these issues at scale, we really need to understand, not only from a moral perspective that this is going to be better for health outcomes, from a financial perspective, you need to close the loop and really understand what is the eventual impact. And that whole piece of the puzzle, coordinating around the need, just does not exist at all. And that's really why we got started. We looked at these pain points and said, I know for certain there's not a magic bullet here, but I don't want perfect to be the enemy of good. And when we saw the status quo that was pretty terrible, we realized there's got to be better ways to find and identify needs. There's got to be better ways to connect people to the right services and understand what services are being helpful. And there got to be better ways to prove that this is not only the morally responsible thing to do, but the financially smart thing to do in the context of the US healthcare system. And from day one, that's been our focus. We're addressing social needs to help people thrive, and I think thrive is really the operative word here. I'll talk a little bit about our business model in a bit, and while we are obviously driving down in the healthcare world and healthcare marketplace, these needs touch every aspect of life, and I think once these barriers are removed, the chance for communities and people living in communities to thrive is significantly easier. So what do we do? So I'm going to talk a little bit about the Healthify solution step by step in terms of how people use it out on the ground. So number one, we roll out what we call our community resource platform. So you can think of this, even though I hate the phrase, a Yelp for social services. So anyone can go in and search for any need in an area. And we basically build these databases through technology of web scraping and a set of algorithms. And you can type in really anything you need in any place. So mobile food distribution for diabetic senior in a 2-mile radius around this auditorium. You can find that. You can filter for any need. You can share it, edit, comment, favorite, subscribe, all the things you would expect from an interface like Yelp, except now apply to a really important need of connecting folks to social services and community services. And that's really step one, is helping people find the services that might be beneficial for them and where they're living. Part two is we roll out ways to actually track these needs and track what referrals are being made. So let's say you refer someone or someone needs help with job counseling. Now what we do is we're able to track that information and see what was the success of what happened to that job counseling referral. Was it helpful? What was the feedback? What happened? Do they need another referral? And have a nice interface where you can not only search for the service, but now actually track what services are being referred to different people in the community. And then we have a screening system as well, where going back to the original pain point, where we just don't know who is in need and the severity of their need, we have a really nice web interface that's backed into a matching algorithm where we can ask people questions around their situation. And what you find is these needs are not easy to talk about. And interestingly enough, a web interface and that degree of anonymity actually allows people to reveal some of their issues very clearly and very quickly. So we're able to get some really powerful information on what is your housing status, what is your employment status, what are you really concerned about, have you had trouble paying for food, are there any issues of intimate partner violence in the home? And we can take that information and automatically match people to appropriate services based on how they responded. And then integration. So if anyone knows the healthcare world in the US, obviously payments are kind of a mess and changing slowly with the Affordable Care Act, but workflow and integrations into IT systems is pretty key. So from day one, we've kind of built the infrastructure in a way where we can integrate in existing systems so we not intrude on the workflow, but really work with it. Instead of reinventing the wheel, let's use the tools at our disposal and actually have all the powerful people in the healthcare system and all the great work that they do add another tool in their toolbox to address some of these needs more systematically. And then finally, some of our recent work is closing the loop, going back to pain point 3. How do you connect point A to point B, from healthcare system to the community agencies that address these needs systematically? How do we get them speaking to each other and really looking at this need holistically? So we actually onboard community-based organizations on the Healthify platform, and people can talk to them. And they can actually say if they actually completed a referral or not. So you know 100% certain, with 100% certainty, that someone has been referred to a service and it's been helpful. And that service, we actually know their capacity. So finally, there's an understanding of what is the demand and supply of all of these services in each community. So you can really better understand what services are not in an area. Where do we need to invest time and money into to actually improve the service sector for certain needs? And that really gets back into some of the reporting we do as well, which I'll show you really quickly. So everything we do in Healthify, we're reporting and we're tracking. And this is done really methodically from day one, where we realize the end goal is it's powerful to connect people to services, but we really want to build this and change the policy discussion. We want to change the clinical delivery model. And the only way to do that is if you really prove out that if you connected someone to a service, there was a substantial change in outcomes and spend. So everything from screening all the way down to status of successful referrals is tracked and tied back. And going back to our business model, which I'll talk to in a bit, we really started off wanting to sell directly to insurance plans because they have a lot of the data on claims and spending. So we can actually draw those things down the road. So here's a quick pie chart just to illustrate some of the points I talked about earlier. So based on a few months ago, 9,000 data points of referrals from community health workers operating in 22 states. And as you can see, no surprise, food and housing is the top need. Health-related needs are significantly lower, and this is primarily through a Medicaid and LTSS population. And we do other really powerful things with the reporting. Just to give you a sense of the types of insights we can derive, here's a heat map of housing resources in the DC region. Because not only are we understanding what resources are available, but we're also understanding what the need really is, and we can layer both on top of each other. And we could see one of our clients in DC, they had a huge affordable housing need, and the reality is in certain areas they were operating, there were no housing resources. And this really compelled them to invest time and invest money in certain community organizations focusing on affordable housing in the DC region. So people use these insights to really drive decisions down the road, which I think is incredibly powerful. And we made a lot of progress. We got started at the end of 2013, and we raised capital about 5 to 6 months ago. And I'll briefly talk about how we methodically thought about raising capital and why Acumen America was one of the best fits for us. And we're really glad to have them on board. Was we wanted to make certain that when we raise capital, we want to prove that you can be a mission-driven company, right, baked to your DNA, but still grow an incredibly large company, hire the best talent, and be kind of part in the startup world. That's all the craze right now. But at the same time, we wanted a partner who understands our mission, who can hold us accountable and help us think deeply about impact metrics and how are we really proving value? How are we really keeping track to that initial phrase we had in the early set of our slides? Which is why from day one, we talked to Acumen America to bring them on board, why we still were speaking to other investors and really were able to build a really powerful syndicate where we get both vantage points, which helps us really refine our approach and allows us to really understand what our impact is at scale. So in a high level, we are active in 25 states. We have over 4,000 healthcare staff using the product, about over 100,000 searches for people in need, working with some of the largest healthcare insurers in the United States, like Blue Cross Blue Shield and United Healthcare, some of the largest hospital systems, Johns Hopkins, where we came from as a client of ours as well. And we sell to these folks on kind of a classical per user per month model. So it's really simple, classical SaaS model. And we've seen a lot of success in the healthcare marketplace, but I think the beauty of our model is healthcare is really what we're purely focused on right now, but we've seen interest from self-insured employers to local public health departments to large nonprofits, because kind of the core aspects of our platform, from connecting people to services, tracking referrals, and reporting, has pretty wide applicability. So we're still even learning how big is this marketplace and how much more impact can we grow. And I think one more powerful thing is we get comments like this every day, where people are able to find services for people in need consistently and unlock a set of generational impact, which I think is quite profound, which my team is really passionate about and I'm really excited to expand on. Thank you.